what happened between the time that she first came to Zenith and then when she left after a few months is something everyone deserves to know. Today I'm going to tell you a story about a patient of mine. Not because her story has a perfect ending, though in this case it does, but because what happened between the time that she first came to Zenith and then when she left after a few months is something everyone deserves to know. Let us call her Priya. When she first walked into Zenith, Priya was 36 years old. Before she even sat down or said anything, she handed me a folder. A thick folder. Reports, consultations, prescriptions. Priya was a nurse and currently situated in the UK. At adolescence itself, she was diagnosed as a case of PCOS, which is polycystic ovaries with irregular cycles. She had also put on weight and was hovering around the scale of obesity. After about trying for 2 years to have a baby, she then sought medical help. The first thing she was told is that reduce weight. And of course, the diagnosis of PCOS was given for her irregular cycles and she was also put on pills. So, Priya went on to the path of reducing her weight. Over the next 4 years, she tried reducing weight, taking pills, and even tried switching multiple doctors. Finally, when she met her fertility specialist, they ran hormone tests on her. And do you know what was found out? That her AMH was low. She had a borderline antral follicle count. All these years, while she was diagnosed as a case or labeled as a case of PCOS because of a past diagnosis, and she was trying to reduce weight because of her obesity, her antral follicle count was dropping and her ovarian reserve was dropping. This is exactly what happens sometimes, especially with different ethnic backgrounds. As Indian women, we have a slightly lesser ovarian reserve. And this is what many times gets missed. And while you wait, the reserve keeps dropping. And that is why it is so important to understand the ethnic differences between regions and countries. After this diagnosis, what she was told is that natural conception would be difficult and IVF is the best option. Priya was reluctant and here she was directly needing to go into an IVF procedure. Despite being reluctant, she followed the advice and went through one IVF cycle, which unfortunately failed. When she came to Zenith, she very much wanted to give her body a chance to see whether conception could happen before she attempted the second IVF cycle. We talked for over an hour and slowly the picture started emerging more clearly. Obesity had been tackled, but not completely. She was still overweight. Insulin resistance was still there, which needed to be corrected. We tested her thyroid levels and her TSH was 4.2. Looks within the normal range, yes, but for fertility purposes, we prefer the TSH being within 2.5. And hence, there was this need to start her on some thyroid medication. We also understood that her stress levels were very high. She wasn't really concentrating on her diet, on herself, on her stress levels, on her exercise. That also needed to be tackled. And then we looked at her husband's semen analysis. He had a basic semen analysis done. And the sperm quantity was slightly on the lower side, though within the normal range, and motility was just suboptimal, but not very low. Then we decided to conduct an advanced semen test, which we call as a sperm DNA fragmentation. And his sperm DFI was 35%, which was pretty high. That was one more reason why pregnancy was becoming difficult. Now, slowly, all these small points were emerging which showed that corrections were possible and that could possibly change outcomes. So, what did we do? We did not advise the next IVF cycle. We decided to wait. 3 months is what we told her. And then started acting on all the multiple levels that we needed to. First, around her weight and her insulin resistance. We started her on supplements such as inositol, coenzyme Q, vitamin D, folate, especially all those which are important for insulin resistance as well as for a low ovarian reserve. Because the issue with age and ovarian reserve when it is low is not just the quantity, but it is the mitochondria, the ones that give energy to the cells, to the eggs, that start getting affected, and there is a lot of need to correct these. These antioxidants are like a new lease of life for the aging eggs or the eggs that are lower in quality. We knew that her stress levels are high, so we advised yoga and breath work. At the same time, we looked at what changes could be made in her husband's daily lifestyle. He had a history of alcohol consumption, high stress at work, very irregular sleeping patterns, and poor diet. We decided and counseled him to change all those. Also put him on medication and antioxidants which contained coenzyme Q, zinc, selenium, astaxanthin, all the antioxidants which can help sperms. We also did a scrotal Doppler just to make sure that the high sperm DNA fragmentation was not due to a varicocele. All this started, and then we decided to try monitor her natural cycles. We monitored one natural cycle, and in the next cycle, we decided to put her on some minimal ovulation induction drugs. And we chose a combination of clomiphene along with letrozole. We monitored her. She had good development of follicles. And yes, it doesn't always happen that you get good follicles and you immediately have a pregnancy. But when you correct the things that are problematic, it can just do the trick. And that is what happened with Priya. She conceived in that cycle naturally, just with the treatment that we had given. And that is important to note. IVF is a remarkable, necessary, life-changing process. And for some couples, it is absolutely the right thing. But Priya's story is not really about IVF or natural conception. It is about investigation. It is about looking deeper. It is about pinning down the problem and finding what can be corrected. Because sometimes this is what can do the miracles that even IVF can't. If something about Priya's story made it feel familiar, then come talk to us. Because you deserve what Priya deserved, the full picture. Thursday free consultations are linked below. If you found this video helpful, share it with others. Not for us, for the woman in your life who's been told that there is nothing more to investigate. There always is.